And good afternoon, everyone. Thank you for joining our Employee Relations and Public Safety Committee, July 19th, chaired by myself, Commissioner Ted Terry, and we have ERPS committee members, Commissioner Steve Bradshaw and Commissioner Jeff Rader. Thank you, everyone, and Commissioner Lorraine Cochran-Johnson. That's all I see on my screen right now. So anyone else will pop up, we'll welcome them. And so we do have a packed agenda. We're going to probably defer a few items, but we'll go ahead and jump right in here. So first we have our meeting minutes from July 5th. And if everyone's reviewed those, we can take a motion for those minutes.
Move to approve.
Second.
All right, motion and second. Seeing the discussion, all in favor, raise your hand, say aye.
Aye.
Chair votes aye, motion carries. All right, we started our employee clinic presentation last ERPS meeting. We're going to take about 15 minutes, actually exactly 15 minutes, Mr. Jacobs. Commissioners and committee members, if you do have a question during the presentation, go for it. But we'll try to keep that 15 minutes cap so we can kind of tackle these other agenda items that got deferred last time. So Mr. Jacobs and Mr. Haywood, y'all have the floor.
Okay, thank you, commissioners. And we'll get right to it. And Brett, if you could share screen. Just as a short recap, when we last met, we talked about the efficacy of adding an employee clinic. We're calling it a near-site clinic because we do not actually have a space in a county building. But we did do some studies to show that the proposed location is readily accessible to nearly all employees. Today, we want to narrow in on cost and talk a little bit about ROI. And then we'll also give you a few pictures of the proposed location. So let's skip, Brett, if you don't mind, right to the cost summary. And you might remember 2 weeks ago, we talked about two different proposals. The one that we initially were recommending involved only allowing employees to have access to the clinic. The cost is about 50% of providing clinic access to families and their dependents. But since our last meeting, we've learned that Everside, which would be our clinic partner, Everside would manage the clinic, staff the clinic, decorate it using our logo, making sure that it's marketed like a DeKalb County clinic. They would need about 4 to 5 months to staff it and to actually set the clinic up and have it looking the way we want it to look. Even though it's already a doctor's office, there's still some cosmetic work that needs to be done. So having said that, we had wanted to start off with sort of a soft open using option one, which would be one nurse practitioner and one medical assistant. But now, since we're looking forward to an open date closer to January of next year, we're going to propose sort of redirecting our budget efforts to option two, which is a full service clinic that would provide services not just for employees, but for employees and their families. That cost is about $1.1 million as opposed to $650,000 for a clinic that only serves employees. But we're going to put in our fall budget request, a request to fund it with the option two model. And it could be that we start out the year with a soft open with the option one, and then potentially migrate over to full service. But we still have more discussions to have with Everside, the clinic facilitator, to make sure they're able to staff either model. But as we sit here today, we're proposing a January open date as opposed to opening up this fall. And when we open in January, we're going to propose offering services to employees and their dependents. And we think this is going to be better for employees because talking to other counties that have already set up their clinics, they seem to get more satisfaction when services are offered to families. And we think that we would have a better chance of meeting our ROI if we offer service to employees as well as their dependents. And I remember, I think Commissioner Rader asked what our break-even point would be. And under the first model, we'd be needing about 40% of our self-funded participants to use the service. And we have, that means roughly about 1,400 employees would have to go through the doors to get us to a break-even point. Those are the folks that are currently in the Anthem plan. This clinic is not available to Kaiser members at this point, but if we have a successful launch and get the ROI that we're anticipating, we'll start talking with Kaiser to see what it would look like to add Kaiser participants, which I'll remind you is over half of our employees are currently with Kaiser. And Kaiser's approached us about getting a shared space in this clinic. They're doing it at the City of Atlanta with some success, but we want to watch that shared model for a little bit and make sure we understand all the ins and outs. And then if it makes financial sense to allow Kaiser members to use that facility, then we'll do that at some point in the future. So that's a quick recap of the cost proposal. And I want to turn it over to Brett to take it from there.
Okay. Appreciate that, Larry. And I'm sure Commissioner Rader, you may be having the same question on option 2. What does that break-even point look like? So to anticipate that question, so right here you can see at the bottom, estimated savings are based on an 80% participation rate in year 1. The break-even point on that would be employee participation around 85%, and then the spouse participation rate around 60%. That would give us a year 1 break-even or positive ROI, if you will. If we want to look at a year 2 break-even, which is probably a little bit more likely, we're about a 65% employee versus and 40% spouse participation rate. And when we say spouse, we mean dependents, not just spouses. So it's about that year 2 point is where we break even. And then on a go forward basis from there, it would be essentially a cost savings. While there is cost involved in running the clinic, it's a savings over what the cost would have been without the clinic. So any particular questions on the cost proposals? Otherwise, we'll move right in. Commissioner Rader?
You know, you're talking about initially basically our self-insured or point of service type lives being receiving service in this way, but this is a little bit more like an HMO model, isn't it? In other words, you are basically seen by a staff healthcare professional. There are no specialties particularly offered within the clinic, but instead it's more of a primary care sort of a scenario there. And so do you have data on the, I mean, it seems as though if you had a preference for that type of a service delivery model, you might already be in our HMO program. So do you have any experience data related to that type of, preference or sensitivity that our self-insured POS type lives would, why they would prefer this over going as they now do to a individual healthcare provider?
So kind of sort of an answer to your question here. This is not, the clinic would not be intended to replace any primary care physician or any existing relationship with their doctors, their providers, the facilities that they go to. The clinic is merely here for some of those more, immunizations. I've got a runny nose and I feel sick, but I can't get into my doctor for a week or 2 because they're too booked. I need an annual physical. My child needs a physical to enroll in the soccer program down the road. It's intended to be some of those quicker, more immediate services that your members could go to and receive much faster, therefore being a higher productivity at work, less time away from the office, less time away from their job. So yes, you're right in terms of it does function more like an HMO style, meaning that this is the clinic, this is where you go. You don't have a whole bunch of options, but this is not taking away any of the options that those Anthem members currently have if they're enrolled in the HSA or the POS plan, or even the HMO for that matter. They can still go to those same providers. There's no change there whatsoever. This is just giving them an additional option for services when and where they need them at a much quicker and lower price point. Therefore, also saving the county money, because going to get, let's say, that immunization or that physical might be a retail cost or a negotiated contracted cost of $150 at your PCP. That cost could only be $50 at the clinic. So it's not only saving your member some of that out-of-pocket cost, but it's saving the county money to not having to pay that $150 claim. So that's not, hopefully that's answering some of your question. I don't.
Well, let me ask it a slightly different way.
Okay.
Then, is how does this compare in terms of cost efficiency when compared to an urgent care or immediate care type of option that's already available to them?
Right. I mean, the cost here is going to be significantly less than, so like, for instance, using that example of an annual physical, those run give or take about $150-ish, depending on your provider and what organization, whether that's Piedmont or Northside or whatever.
That's in an immediate care, not a PCP. Is that right?
Right. Yeah. And sometimes people, Commissioner, they end up going to the emergency room. That can cost $3,000 after they get run through all the tests.
Yeah.
And so
just trying to understand, related to the other options that are available. I know that, my dependents have used immediate care, particularly where there's, they've got a cold or something like that and they want care, or the flu. Obviously, you can't get into your PCP very easily on that type of a thing. And so you go to an immediate care and they tell you whether you got strep throat or something like that. So this is more cost effective than it would be to pay for that service through an immediate care that's in network. Is that right?
Absolutely true. Yes. Now, if you've got, a broken arm, you're not necessarily going to go to the clinic because we're not going to be doing x-rays and that sort of thing.
Yeah.
Right. So it is more of the sickness type of visits, the physical type of things, and just some of those, they need help and they need it quickly because they're sick and they need to get on an antibiotic or something like that. I mean, it's going to be more of that. And I think we'll get into, let me just
the final question.
Forward.
Will the participant get will it be more, cost effective for the participant in terms of the cost of receiving that service in our near clinic,
Correct. And up here on this first screen, we talked about a couple of weeks ago, the intent would be is to provide the members with a $0 copay, right? Except for those in the HSA, which they are governed by the IRS rules, that they would have to participate to some extent. So we'd probably set that copay somewhere between $25, $30, just so that we're compliant and the clinic is compliant with IRS rules. But yes, it's much more cost effective for the member as well. So you have lower out-of-pocket costs for the member and lower quote unquote claim costs for the county versus running these same services through the Anthem network.
Thanks.
So you're welcome. And then here, this bottom box gives you an idea of the services that are commonly offered among employer-sponsored health clinics. So kind of to what we were talking about, here's your urgent care or immediate care type stuff. They would also offer telehealth visits, occupational health, lab services, some pharmacy-related services, mental health, chronic condition type management, wellness coaching stuff, immunization. So there's a lot of services that are offered, and this is not a comprehensive list. This is just the typical. So there's a lot more that can be added in, and the clinic is not intended to be completely built out and offering all services on day one, right? This is going to be an ever evolving clinic that, as we determine, like there are additional needs that are not being offered today or in the clinic once it's available, that we would potentially over time continue to add on those additional services.
Mr. Chair, how are we doing on time?
I got a few more minutes.
Okay.
All right. So let's, so this, a clinic also helps to increase the trust among your employees, being that, they feel that their employer, DeKalb, has their back and is providing them alternatives, providing them a quicker means to gain access to the healthcare system, allowing for, same day appointments, allowing for their spouses, their dependents to come in to get, their services. So it's more of a convenient type of environment. The commitment by DeKalb to the employees, providing a hub for wellness and health promotion. So there's a lot that can be done on the wellness front in promoting that additional health. Like I said earlier, dispensing, certain types of drugs through the pharmacy there at the clinic, which is, again, it could be more of your, kind of maintenance type medications, antibiotics, et cetera. Around specialty care, it's going to be more of referrals. There's not going to be necessarily, you go in there and you're looking for an orthopedic visit, right? But you may go in there because maybe you do have a broken arm and you want to be seen and you want to see what's going on. They may refer you out to a specialty provider, but as part of the clinic, the referral source from the clinic may be a specialty provider that's a higher quality but lower cost provider. So it's a way for the clinic administrators to be able to refer folks to higher quality, lower cost options within the Anthem network, which again saves the county money and the members money out of pocket. Regarding this bottom one here, pediatric care, well child visits, immunizations, the sports physicals, et cetera. And option 2 that Larry spoke about earlier, while allowing spouses and dependents to have access to the clinic, it would only be for dependents over the age of 2. So there is a limitation there. We wouldn't necessarily be asking for them to bring infants into the clinic. So it's age 2 and above for all dependents. Clinic location, this is over off of Wynn Way down in Decatur. And you can see here, this is a heat map, which basically shows the green dot in the middle is the actual location with all of the grayed out areas being where your employees live. So this is all of the folks within the county population. And so you can see just how centrally located this potential proposed site is among your employees. And a few of the photos, we don't necessarily have any of the inside of the building right this moment. But this is a prior doctor's office, so it is already set up, which can be utilized as a clinic. There will be some build out required, but not as much as it would be to buy or lease an office that is not already structured for a clinic or doctor's office. So a lot less of a lead time and build out time to open the doors here. But nonetheless, it's a parking lot that's got a number of parking spots, plenty of open area for vehicles, as well as the street that is on Wynn Way allows for large trucks to be able to come through and park as well. So all those folks working in the large vehicles, through Watershed, through any of the other departments who are driving the large vehicles, there's plenty of location for them to come in should they need to come in during their working hours. So it provides access for everyone, no matter if they're at work or off of work, and personal vehicles or work vehicles. And this is basically gets into our kind of next steps, which would be hopefully to move this into a formal recommendation for all of your consideration at a board meeting, upcoming board meeting. So I'll stop for a moment. I know we're probably right up against time. So any particular questions on any of this, as I just kind of threw it all at you?
Yeah, let's open up to the committee members first. And maybe if y'all could just opine on option 1 or option 2. Would love to hear from the committee members on what you think. Go ahead, Commissioner Rader.
I'm going to say let's start with option 1, get it underway, and see if we can add that. I think that the word of mouth from the employees will do a lot to bring the their families in. So I think we need to get a little bit of time for them to get the word out. I'm not suggesting we wait, a whole year, but get it up and running with the employees themselves, and then maybe within 6 months we bring the others on.
And there would be a lot of additional, communications that we would do, as we're leading up to opening those doors, right? Communicating to your folks, making sure that they're aware this is coming, what it means, what they have access to. So what we would call change management, right? Just that this is something new. So obviously leading up to opening those doors, being able to keep people, kind of hyped up, if you will, that they have this new access to this clinic. And then to your point, once folks start going and they get in the door and they start realizing what it's all about, it does spread by word of mouth. And so hopefully that will drive more participation into the doors.
Okay. Commissioner Bradshaw?
I'm good with that.
Good. Okay. Yeah, I had the same thought. I think I really like what I think is being discussed as sort of things are expanded. But, like y'all said, the soft launch is a good way to kind of just get things rolling, build some rapport with the employees and also maybe get their feedback before we expand too much. The only question I had was about the medical assistant. I know that's kind of like the lowest ranked person. Can we ensure that we're paying them at least a $15 minimum wage? Can we make sure that's in the contract?
Yeah, I think that's something we can certainly negotiate with Everside, even though the individual would not be an employee of the county. We can share with Everside that that's been a county initiative, and we'd like to see them within the constraints of the proposal to offer a fair and living wage to the MAs, and we can certainly suggest the $15 an hour.
Okay, I think that's important. I think just because we're talking with Grady about their nursing shortage, and I'm assuming that at some point in the next year we might get competition for medical assistants. I don't know. So I think as long as there's a way for Everside to stay competitive with the nurse practitioner, that's probably a separate issue. But the medical assistant, I think, would be great. Any other commissioners want to come on here and just sort of weigh in? I think the big decision is option 1 or option 2. So if anyone has any thoughts, speak up. Or you can just email everyone and just weigh in. And so I think, so Mr. Jacobs, Mr. Haywood, Kirsting, are y'all going to sort of come back with a more formal proposal for one of the options based on the feedback you get?
Yes, since we know now that the soonest we could open is early 2023, we're going to bake in options 1 into our budget request this fall, but with look forward to going to full service in the second half of 2023. So probably the way that looks like is we request funding for option 1 in September, and then at mid-year budget request next year, if the clinic is running well post soft launch, we'll ask for additional funding to extend to dependents in the mid-year budget request about this time next year.
Gotcha. Okay. And I think maybe just the one thing I would add is I think whenever it's sort of the moment to kind of do the soft launch and there's like an actual operation, would love to just arrange for the ERPS committee members to get a tour, check it out. I'm a Kaiser, so I don't think I'm not gonna go there, but would love to tour it just to put eyes on it.
Yeah, absolutely. Be happy to arrange that.
Excellent. Go ahead, Mr. Haywood. You were gonna say something.
I guess I was just going to come back to the kind of where we go from here. That early January launch date or open date. If we start backing up from there, it's a 4 to 5 month kind of lead time to get the doors open. So I guess I would just ask the question of you guys, which is it sounds like the consensus is option 1 to kind of get started. See how it goes, and then potentially expand into option 2. So I guess I'm asking, is that kind of the decision at this point from you all to move this forward so that we can kind of take that next step on a more formal vote?
Yeah, that's
at
a great
the board,
question.
or
Would y'all like an official recommendation right now from the ERPS committee?
Well, we're certainly proposing a soft launch of option 1 with the migration to option 2. And if it's appropriate, Chairman Terry, we'd love to get that direction formally.
Yeah, committee members, are y'all ready to move forward today?
But what's the timing on that? It seems as though that's a little bit different from what maybe we were discussing. In other words,
Well,
the transition to
Go
the
ahead.
soft launch to the broader.
Yes. So in a perfect world, we'd get 4 or 5 months under our belt under the soft launch with employee services only. And then if that's going as well as we expect, then we would propose launching service to dependents in the second half of 2023. And we'd make that request along with the mid-year budget request in June of next year.
Okay, so soft launch, is there a participation rate that's associated with that particular profile? In other words, are we talking about going from, say, 10% to 40%, which I think you said was your break even? And then once we get to that break even for the employees, then we would move to include their dependents?
Yeah, we could structure it to get to that 40% mark under the soft launch with employee only. I kind of hate to be tied into that because I would think, Brett, you would need almost 12 months to get 40% of that population.
Okay, well, I'm not saying that that has to be the 40%, but I'm just saying if you would tell us what those thresholds are rather than we're going to have a soft launch and then we're going to work our way into it. That just, there's no real
metrics
for the give and take, or, for the dependency of the success in one to opening it to the other.
So we can develop some metrics to look at in the first few months of operation that would help us determine the appropriate time to expand that service. And we'd be glad to develop those metrics and bring them back to you with our formal budget request this fall.
I think that would be a good way to do it, is to, actually build in some thresholds to move from one model to the other and how quickly we'd like to move from soft launch to break even. And then when we would start the expansion of service and what our goal would be as it relates to that participation rate, which I think you said was 80% total. That seemed to be a lot.
Yeah, under the option 2, it was 80% participation, which is a blended number. So it was split out 65 employee, 40% spouse to break even in year 2 under that option.
It's additive in that way.
Yeah.
Yeah.
So
it's
not 85% of all eligible.
Correct.
Right, that's an odd metric. It would be interested to show, other metrics that were more, I guess, inclusive of the entire population. 80% to me means 80% of the total eligible population, but that's not really what you're talking about.
Well, 80% of the enrolled population within Anthem.
Minus, not including Kaiser.
Yeah, so not including the Kaiser folks and not including your employees who do not elect county healthcare.
So I don't want to go back and forth on it. If y'all would just, make some proposals as it relates to those thresholds.
Sure. Yeah, and I think that makes a lot of sense because, now that we have kind of an idea of how we want to approach this day one, right? So go into option 1 first and then eventually expand into option 2. To your point, that allows us to kind of map out a little bit more of a defined approach to how we're going to do that, the timing around it, what the participation rates may need to be after 6 months, 8 months, 12 months, whatever. So it may end up being that we need to wait until year 2 before we expand to option 2. But we'll just need to map all that out for you and kind of lay it out and let you know, kind of show you what that means.
Okay. Well, I think we can give you all the go ahead to sort of move towards kind of doing the metrics for option 1. And then it sounds like we just need to make sure that's part of the budget discussions. And so between Mr. Jacobs and Mr. COO Williams, you don't need action from the committee right now. It sounds like you guys have a direction to go in, so you can.
Yeah, I think that's a fair statement. Don't you think, Larry?
Yeah, we don't have an agenda item for you at this moment. So this is just giving us a broad direction as to preference.
Okay. All right. Very good. Well, yeah, let's move forward with option 1. And then, we'll welcome back some more specific numbers for the first sort of year of operations and when the mid-year budget is discussed.
Okay. All right.
Perfect.
Good. All right. Thank you all very much. Appreciate
Thank
it.
you. Appreciate it.
Thank you.
All right. Thank you. All right. Moving on. Let's do our public safety report. And Mr. COO, who wants to?
Sure. And well, Mr. Chair, I will, kind of start. Actually, the presentation, though, will be provided by the Public Safety Director, Jack Lumpkin, and of course, Police Chief Martha Ramos. And there may be some components where TJ will add in to discuss the budget. But yes, this has been a long time coming. Thank you for providing us with the opportunity. If you recall, Mr. Chair, we began attempting this back in, I don't know, probably February timeframe, where we were, in preparation of the budget. And what we've been able to do is to provide updates to this report, whereas there have been a number of items that were placed in the 2022 budget or were about to be placed in the 22 budget as commitments or things we hope to achieve. And we are now going to be able to report many of those accomplishments. So without taking too much time, I'd like to just hand it off to Director Lumpkin, who will provide an overview and then introduction of Chief Ramos, who will get into the details and walk us through the report.
Thank you.
Thank you, sir.
Lost the screen there. Good, Director Lumpkin.
Good afternoon, Mr. Chair and Commissioners. This afternoon, Chief Ramos will present to you some of the highlights of the 2021 DK accomplishments, as well as the what you all actually approved for the enhancements for 2022. Before the Chief begins, excuse me, I would like to call your attention to a few facts. The next slide, Mr.
There we go. We see it.
All right, next slide. As you will recall, President Biden recognized and commended DeKalb County as the first jurisdiction that actually used the American Rescue Plan money to combat crime. The CEO and the Board of Commissioners allocated ARP funds to numerous public safety agencies in the DeKalb County as a means of enhancing effectiveness. At the time that was done, really, that was a novel idea. Other people hadn't thought of it or was not doing it to our knowledge or to the administration's knowledge. Actually, the money was allocated through the solicitor, the DA's office, and it was to and the police department, as well as other public safety entities, to combat crime and engage citizens. To combat crime, you really have to engage citizens. There's 330 million Americans in this country and around 875,000 law enforcement officials. It's not going to work without a partnership. Next slide. Second, you will recall that Attorney General of the United States, Merrick Garland, the highest law enforcement official in this country, recognized DeKalb County's PAL program as an innovative community-oriented policing endeavor. A.G. Garland personally presented the award here to the DeKalb County PAL unit, the 3 detectives you see there on your screen, in recognition of their virtual summer academy. That academy connected citizens, kids, young people, through Zoom with businesses, groups, leaders, etc., to better prepare those young folks in gaining full employment. The young people were able to actually develop life critical work skills. And this was done in partnership with Georgia Piedmont Technical College. Such efforts, as the Attorney General stated in his own words, they build trust between law enforcement and the community. And that reiterates what I was saying earlier. It does not work. Public safety does not work without community participation. Next slide. The final area I would like to touch on before Chief Ramos takes over and presents is the homicide statistics. I know you can agree one homicide is too many for our community. One homicide is too many for any family member. But while some jurisdictions have continued to see a significant increase in homicide, DKPD in DeKalb County through June 15th of this year actually had experienced one less homicide than in the previous comparable year of 2021. Essentially, for the last, although there are small increases, we have not experienced the 15 to 20 to 30% increases as other jurisdictions, similar jurisdictions in the United States have. You can also see that our clearance rate is significant. They're 79%. The national clearance rate for homicides is around 54% on the last published data, and it typically runs a year behind because it is not published until October of each year. But we in DeKalb typically will have a high 70 to low 80 percentile clearance rate, which again is remarkable for a jurisdiction of our size as well as our complexities.
Let's pause that real quick there, Commissioner Bradshaw.
Yes, thank you, Mr. Chairman. Thank you, Director Lumpkin. I'm just curious as to what do you think is responsible for our clearance rate running so far ahead of the national average?
I think that you have a significant participation of citizenry helping homicide detectives. And I think you've had great knowledge, skills, and abilities in that homicide unit for a number of years. There's a lot of effort and leadership paid towards solving homicide. You know, it's what cops really don't want to do, but love to do in terms of it. If it occurs, we want to get to the bottom of it. I think DeKalb does it as well as any major agency in this country.
Thank you.
It's typically around 25% to 30% in most of your jurisdictions that you know of.
And Director Lumpkin, just to clarify, so the clearance rate is not necessarily an arrest was made. It just means that a charge has been laid or an arrest, or what's the other sort of
exceptionally clearance is another one. If a perpetrator, if we had a warrant for an individual for murder, homicide, in Georgia, it doesn't have a homicide law, it's murder in Georgia or criminal. If we had a warrant for the individual and he was killed in another a motor vehicle accident, of course, we can't arrest him now. Or he was killed in another crime, we can't arrest him now. So that's an exceptional clearance.
Understood. Okay. But I think, and I mean, I would say that the average person would look at a clearance rate and think that a crime has been solved.
It has been.
Well, but
we know who the perpetrator is.
Yeah.
We have the ability to take a warrant on it, you know, and we actually have taken a warrant on the person. Or the person has, if you think of a lesser crime than homicide, a person that we had a robbery warrant on, strong arm robbery, no gun involved. He was caught in North Carolina for murder. They're not going to let us have him. Right. So if we could clear that case, but we have to have enough probable cause to have a warrant. And they're not going to let us have a warrant on those kind of circumstances unless the DA and others thought we had enough to actually get an indictment.
Gotcha. Okay.
The case is solved. Now, we may not be able to put our hands on the individual and try the individual. Another state may not allow him or her to be returned to Georgia, extradited, or the person may have been killed, and that's a lot of it. They've killed in other behaviors.
Gotcha. Okay, thanks for clarifying that. Go ahead.
And Mr. Chair?
Yes, sir.
As it relates to, and we welcome the opportunity to come back at a future meeting and really talk through statistics
Okay.
What we wanted today's conversation really to be is about, kind of where the police department is. And so this is really going to be, as you'll see, a very police-centric discussion. But I think an opportunity at a future meeting to talk more broadly about our comprehensive strategies for public safety that have included, quite frankly, some of the funding through the ARP and other methods of things in the courts, the justice system, all the partners. And as we all know, when we're talking public safety, even investments in parks and other things are part of that whole strategy, and that's been our philosophy. But at this point, if it's okay, I'd like to have Chief Ramos kind of walk through the balance of the report, describing how our police department is structured and what they've been up to in 2021, thus far in 2022, and where we're going in the future. Okay.
Great. Thank you. Welcome, Chief Ramos. Thank you.
Good afternoon. So we'll start with a chief of police. Obviously, that would be me at the moment. I have a chief of staff who helps me oversee the department. In our uniform division, that encompasses all of our uniform patrol officers. It also encompasses investigative detectives at each precinct who they work robberies, they work burglaries, thefts, and some of those things that are not handled by our main criminal investigations division. And they also now include our community policing unit and our CSAs. In our special operations division, it actually encompasses two smaller divisions. So we have special operations that encompasses our SWAT team, K9s, motors, and our high liability units, in addition to the support side, which deals with all our administrative options like open records, central records. It has PAL, it has our ATU, which deals with our body-worn cameras. So it encompasses our special liabilities and our administrative section. And our criminal investigative division encompasses homicide, special victims, gangs, intel, and they house all of our criminal investigative division investigators who do not work out of the precincts. Next, please. So for 2021 accomplishments, we had several, I believe. So we had two where we created 2 civilian positions, and we created those positions so that we can have more officers on the road. So the community service aid positions, they were created to assist officers on the road with the low-level calls that don't necessarily require a police officer. Our public safety support assistants were created to get officers more on the road. So we had officers that worked in the fleet unit. As they retired, we provided them with 2 PSSAs rather than taking 2 officers in the road to take those 2 positions. They're actually in our permits unit. We actually have one in PAL. So we're utilizing them where we usually have officers, but we don't require officers to have those positions. And I think at this moment, we may have 6 filled positions and trying to fill 4 more. Accomplishments, increasing our community engagement efforts by utilizing the community policing units, our Majors Night Out, and hosting virtual town halls. I'll talk a little bit more about what those entail a little later. We've enhanced recruitment efforts by putting our recruitment advertisements on billboards, on bus stops, in social media. So we've done a lot as far as trying to recruit, in addition to our normal resources that we use for recruitment. As far as training, we're definitely trying to enhance our training. All personnel receive CPR training. That's something that was new. Initially, you only received CPR training when you first came on the department. Now we'll be having refresher training every 2 years to make sure that our officers are trained, certified, and feeling comfortable in utilizing CPR. We've also increased our de-escalation training from 8 hours to 40 hours for our recruits. We're only mandated by post to do 8 hours, but we know how important it is, so we've increased our hours. 81 of our officers have completed CIT training in 2021. Our goal is to have 100% completion by the end of the year. We have about 100 officers that are still pending CIT training, but as time goes on, we hope to limit that number as we have worked with Georgia Post to have CIT training conducted with the recruits. So now they actually come out already CIT trained rather than having to be pulled for the road for the 40-hour training. So hopefully by the end of the year, we'll have all of our officers CIT trained. In addition, we've created the duty to intervene policy. It was not something that was mandated. It's something that we took the initiative to do, knowing that it is important for our officers to know that they do have a duty to intervene if they see something inappropriately being done by one of their peers. And not only did we create the policy, but we also had an outside company come in and do the corresponding training. So not only were they instructed that they were required to do it, they were taught on what that means and what the expectations are. We've also increased our FTO training from 9 weeks to 15 weeks. What that means is the officer will be 6 weeks additionally in training, which means they should have been released in 9 weeks, but now we keep them an extra 6 weeks just to make sure that they feel comfortable and have all the tools that they need to work as a one-man unit. So we're really taking training to the next level. We understand the importance of it, and we want to go ahead and coincide with what the CEO says with being some of the highly trained and highly paid. So that ties in with the CEO's mission. For objectives for 2022, continue emphasis on our mental health initiatives. The first one, I'm happy to say, has actually already come to fruition, which is onboarding a full-time clinician to be utilized by our staff. This is not anything to do with mobile crisis unit. This is a counselor who we have on staff that we can provide for our officers during critical incidents. If they're having a personal problem and they want to discuss it with a clinician, they can. So we want to be able to take the mental health of our officers just as seriously as we do our community. In addition to that, we are looking into assigning officers on a permanent full-time basis to the mobile crisis unit. Currently, we have officers that are chosen on a daily basis. We're really working to assign people permanently so that we can get them added training, have people there that want to be there so that we can maximize that relationship between them and the nurses rather than rotating that every day. I think that'll make a big difference. And that ties in with continuing our partnership with the DeKalb County Board of Health and the DeKalb County Community Service Board. Also, we want to.
And thank you, Commissioner. Unless you got Commissioner Rader, go ahead.
Just very quickly, could you remind us of the total capacity that we're now projecting in our mobile crisis units in terms of units and then hours of day they're available?
We only have one unit a day, and that goes hand in hand with the Community Service Board. They are the ones that provide the nurses. We provide the officers. We're still trying to work out a more robust system. However, it does rely on the Community Service Board getting enough nurses. So once we do that, we hope to have at least one in each precinct. But right now, sir, we only have one nurse, one officer working for 7 days a week between the hours of 2 p.m. and 10 p.m.
Okay, and so I know that other jurisdictions are not relying so heavily on their CSB. Have we looked at the option of engaging professional staff directly so that we can project a broader availability of this type of service?
We are looking into that, sir, and that was incorporated into our ARP funding. So we have to see how we can still come working with the CSB in order to kind of mirror it rather than just creating something separate. So we're working along with them to see how we can increase nursing on our side. But if they have difficulty hiring, we'll probably experiencing the same. But we do work with them, and we do have a meeting set up with them to talk about how we can work with them and how we can work independently when their resources don't allow us to meet the needs of the community.
Okay, and do you have any measure of the adequacy of our current program as it relates to calls for service in appropriate situations, domestic violence, other, calls for aberrant behavior that might require this type of mobile crisis type? Do we have a measure of the adequacy of our capacity?
We'd have to get that information from the Community Service Board, sir.
Okay, but I mean, our 911 provides the reference, do they not, to the mobile crisis unit? Is that right?
They do to a certain degree, sir. A lot of what we do is also follow up. So if a unit goes on a call and the mobile crisis unit is not available, they will let them know. So when they come in the next day, there's a lot of follow up to maybe the night before. So some of it is E911 dispatch. Some of it is self-initiated. Some of it is follow up. Some people are getting visited on a rotation. So it's not always an E911 dispatch.
Okay, so Mr. Chair, I will yield at this point, but you might, I would encourage us to look more deeply on, measures of adequacy and our ability to more broadly project this particular type of service, since it does seem by many measures to be a very effective way of being able to fuse some situations where projection of force is not always the best option.
Yeah, and we can definitely continue this discussion on this particular topic. I think this might be in a upcoming special call meeting just to kind of dive a little bit deeper, because I know that this is a important, really important service that we're already providing. And I know it's on a lot of people's minds to know how we would continue to support it and expand it as well. So look, let's definitely come back to this, not too long, but don't have time today. But yeah, absolutely. We'll put a pin there and come back to it. Go ahead, Chief Ramos.
Okay, sir. And meanwhile, I'll continue to do some more investigating and see what information we can compile. But we also want to continue to improve our departmental infrastructure. So there are plans to replace the Bobby Burgess building, which is quite old. So there's SPLOST funding for that. That's been in the planning stages. And also the planning for the building. And I say the planning because the funding is for the planning stage only, to replace our training academy with a public safety training academy, which encompass police and fire together in one building. But right now the SPLOST covers the planning portion of that. And hopefully we can get the funds covered to actually get it up and running when the planning is complete. We also want to progressively upgrade aging vehicles. We have several vehicles in our fleet that need upgrading, but we're doing it little by little. So far this year, we've received 100. So, there should be some brand new Tahoes and brand new unmarked vehicles out there floating around. And we hope to get the rest of our fleet upgraded year by year. So we progressively upgrade our vehicles. Our F22 objectives, we want to continue utilizing technology through Connect DeKalb to apprehend our criminals and decrease crime. We want to continue our community engagement strategies with the community policing unit and the implementation of the new mobile precinct, which we have not received yet. Obviously, with all the delays due to COVID, we haven't received it, but we're super excited waiting for that to finally be complete so that we can deploy that to our high crime areas. We want to utilize our PSSAs to assist with live reporting of flock alerts. Right now, the alerts are received via email. So through the use of a PSSA, the PSA can dispatch them so the officers will receive the information much quicker as they're driving from call to call rather than to have to stop and check the email. So we're hoping that will help with a lot more apprehensions as far as flock alerts. And we want to continue our federal partnerships. Right now, we're working with UASI to fund our Metro Atlanta security platform. They're looking to fund a software that we can utilize along with Cobb County and Gwinnett. And I apologize. So Cobb County and Atlanta already have the platform, but they're also looking to bring us on board with Gwinnett and Clayton County. So that way we would all be on the same system, and that would actually help us in having more eyes out here to help us with crime and decreasing crime in the area. So some of these numbers show where our increases and our decreases went, but I kind of just wanted to highlight all of the places where we had increases. If we can go a couple screens, and if we need to come back to those, we can. Next one. There you go. Go back. I'm sorry. So I'd like to go back where it says the highlights.
Slide 13, maybe.
There we go. So this is where all of our increases went to. Most of it was very strategic. We didn't have any extra funding just kind of laying around. So most of it went towards salaries and incentives. Once again, just tying in with what the CEO said about trying to become the highest paid. So we had a 6.25 pay increase for sworn personnel this year, a 4% COLA for civilian personnel, the $3,000 retention bonus for public safety. And then they adjusted the hiring salaries to be more competitive. And so even though we're expecting a salary increase forthcoming, there was one earlier this year for the new recruits and also for certified lateral officers coming in. So that pay has already been increased. And there was an increase for the 401 county match for sworn police officers who are on the hybrid pension plan. So rather than a 3% contribution, they will be getting a 6% contribution starting later this month. So that ties in with salary. We also had the approved funding for flock camera service coverage for 18 cameras. Those are cameras that we've had for several years since the inception of the flock system in the area. So we have the funding for that. Upgrading of departmental equipment, the handheld radios. Most of the department has the new radios, but we still have some that don't. So every year we get 50 to 100 radios. Money counter shelving, just regular equipment that we need just to run day to day. $187,000 for training. Once again, just tying in, we're trying to bring more training to the officers and also sending our officers to get more training. Departmental software such as vehicle installations, the TASER contracts, and just annual software renewal. So we didn't have anything that we really couldn't justify or explain. Everything is more repeat or renewing what we currently had. Replacement of vehicle specialized equipment, such as the light bar and sirens. Every time you get a new car, you're going to spend money to outfit the vehicle with all of these items. Replacement of the mobile radios no longer supported, body worn camera contract, and the counter printer leasing. So these are just items that we need in our vehicles to make sure we're up and running. And the grant match funds, such as the grant, the Metro DUI, the COPS, the Bulletproof Electronic Crimes. Those are grants that we have to match the funds for. And just more items such as the PPE kits, the first aid kits, and just software. So that's something new that's not up and running yet, but that we're working on it. It's a software update that allows citizens to self-report. What we're trying to do is we're trying to finalize that list of reports that they'll be able to do themselves. And we're trying to narrow that down to make sure we don't have any problems with the law department as far as what we're actually reporting or not reporting. And so that's hopefully is going to be something that can help eliminate the cost for service that we currently received. And just uniforms, day-to-day uniforms, sir. And so next, we want to talk about a little bit of our community engagement. I think that's one of the biggest things that we pride ourselves on is how much we are engaged with the community. So we have monthly virtual community meetings. Every precinct has a community meeting, as you can see down at the bottom. Each precinct already either had or will have their meetings, and they have a virtual meeting where they are open to the public. The public logs in. The Zoom information is provided to all via social media and through Nextdoor. And most precincts have an average of anywhere between 25 to 75 people every month who log on. And it's just about communication, talking about crime stats, upcoming events, there are speakers. So we like to stay engaged with our community. So that's 4 virtual community meetings that we have a month.
And Chief
Next slide,
Ramos,
please. Yes.
just on that front, so I'm curious because we were trying to figure out this morning, do we already have, I mean, so we have the precinct community meetings on a monthly basis. So there's a regular, contact with the residents that are served in by those precincts. Do we have, something akin to like, kind of more of a, an advisory committee for those precincts, or some mechanism for it to be kind of a two-way, street, so to speak? There's information given as well as input received.
Well, I wouldn't say we have a formal advisory, but these meetings are really probably more one-sided. We're there really to listen. And so the public are the ones that really dictate how the meeting goes. And at that meeting, they're usually say, well, we would like to speak to someone from code enforcement, or we're having a lot of issues with understanding how the district attorney's office. So they dictate how the meeting goes and who we bring back for speakers. So it's really there just to kind of accommodate the needs of the public.
Okay, thank you.
We also have monthly clergy meetings, and we do that because we understand the importance of our faith-based organizations. So once again, every precinct will host one monthly, and it's faith-based. Anybody can really join, but it's more for our faith-based organizations so that we can stay in tune with their needs, and they can tell us what they need, and they can have their members actually join in as well if they would like to. So that's once a month, 4 precincts, 4 meetings, one at each precinct. So we want to make sure that we engage with all avenues of our community. Also, Coffee with a Cop. As I said, and you can see, we're really, really community engaged. We're about community outreach. We have Coffee with a Cop. Each precinct, once again, has a Coffee with a Cop once a month. Sometimes if you let them, they'll do 2. But as you can see, there's one scheduled or will be scheduled every month.
I wasn't going to make a donut joke, Chief Ramos.
Usually there are no donuts. It's usually just coffee. But yes, we do try to engage wherever it's needed. So if there's a business that may be having a little bit of trouble or need a little bit more presence, then we do it like it's a dual prong thing. So we get to meet the community, but we're also providing a presence to that business where we can learn about the business and engage. So sometimes the business will reach out to us and offer their location for a Coffee with a Cop. It's just a way for us to engage more with the business and also with the people that are visiting the business. So it's just kind of standing around. We don't do too much pushy where they're having them approach us. And we get a lot of good feedback at those meetings. We also invite our public eds, and they provide all levels of information about neighborhood watch. Really, it's about information overload. That's what we try to do, is we want to give you many ways to receive information. And so one of the things that we also implemented was our monthly Majors Night Out. This is for the precinct commanders, not the officers on the road, not for the public as. This is the precinct commanders to get out from behind their desk and go out into the community. And they're required to do this once a month. And why? Because it's important for people to know who is in charge of their precinct, who is in charge of their area. So once again, every precinct is mandated to have one a month. And we're going to have one today. It's going to be a joint meeting between East and Tucker. And they're going to be at Reed End Road and South Harrison Road because we know that's a hot spot. So we quite often go back there. And when you go out there, community's already out there. Once again, it's about engaging, about providing information and being available. So when we talk about community outreach, when we talk about being available to our citizens, I don't think anybody can argue that we're not. We are giving you many platforms to reach us, many different times throughout the month to reach us. And that still doesn't stop all the emails from coming, but we're very responsive and we're always very accessible, as you can see. And I just want to talk a little bit about what we've done. So the career development program was something that we started early 2021. And we started because we wanted to be able to reach kids at a different level. We wanted to reach them in a way where it wasn't one and done. So it's a 4-month program. It's from 15 to 19 years of age, and it's for employment and future career through a series of workshops. We bring people in who volunteer their time and their services, and we teach our kids about the dangers of social media. We teach them how to interview. We take them to interviews, and we've actually partnered up with some businesses that give our teens jobs. So 4th weekend, you already have a job, and we mentor you through the job. We work along with the business as well. So most of our participants are found through businesses, community partners, school counselors, the juvenile probation office. There's no cost for participants. And every class that we've had, we've graduated between 9 and 14. We currently have a class now of 14. And every class we say that it's the best one and the most interesting, but I will say that the current class is the best and most interesting. So our next session for that is in September 27th. We're really proud of that program, and that is the one that the Attorney General, well, one of the key ones that the Attorney General gave us the award for. And we are also up for another award by the Georgia Association Chiefs of Police at the end of the month for this very same program. So we're proud of that. Next, we also currently are having the DeKalb County Police Athletic League basketball after dark. And that starts at 9 o'clock and it goes through, I think they've been out there about 12:30, 1 o'clock in the morning. Excuse me?
Is the championship this week?
The tournament starts today and we will be out there.
Yeah.
Yes.
All right.
So the tournament starts today, but everybody says, well, it's just sports. Well, it's not just sports. We don't do anything to just sports. So we do life skill workshops. Where we talk about gangs, narcotic awareness, financial literacy before they can play. They have to sit there and go through a lecture. And I will say that I was out there, and even though I was half asleep, the vibe was phenomenal. To have a basketball gym filled with 100 kids that could have been anywhere. They could have been a victim somewhere. They could have been a subject somewhere. But instead, they decided to come out with us and play basketball. It's a great feeling if you can come out. We're going to be out there Tuesdays and Thursdays. The tournament starts today and it will go through next week. And as you can see, they'll get trophies. There's going to be awards. There's always a snack and food because there's nothing more kids love than food. And so we feed them and we spend time with them. And so I think it's been very productive. It's something that's been going on for the last several years, not publicized as much as it should. But we have a great turnout. Today starts the tournament. If you want to come out, we'll be out there starting at 9 o'clock today. And like I said, I thought it was very impressive. Citizens
Chief,
Academy.
I want to make sure we have time to get to your 2 agenda items. So maybe just take a few more minutes if you don't mind.
Oh, it'll be quick.
Okay.
So I'm just kind of taking this opportunity to kind of show how much we are involved and engaged with our community.
Absolutely.
So we have the Citizens Academy, which is a 10-week course. We have it every summer. And every summer we have about 50 participants. And this year we're debating, like, do we want to increase it? But we want to be able to keep everybody safe. Last year we had it via Zoom, and some of those Zoom takers want to come back because they want to do it in person. They felt like they didn't get the same experience by doing it on Zoom, but we never have a shortage of people that want to come out and learn about the department. And so we're looking forward to that. And our next class is on August 24th. So we're already set to begin our next one. We also started a youth academy, which really is a one-day event for children between the ages of 14 and 17. They come out, they learn about gangs, they learn about SWAT. They just participate, encourage, and interact with the police department. And we also have some of the kids from last year who are interested in coming back this year. I think at this moment, we have about 17 registrants. We're hoping to get to at least 20 to 25. The next class starts on July 30th of this year. Our community policing unit, this is one of our small units, but it's also very impactful. You'll see them on our bike trails. You'll see them helping code enforcement. You see them out there with community development, talk with the homeless. They work with our nonprofit agencies. This is one of those units that is really making a difference along with our POW unit as far as touching people in a way where they're not accustomed to being touched that way with police. We understand it's not just about arresting people, it's about touching people in the best way that we can. And we really make that our goal. I think that may be our last letter. So do a real quick, sir. Give me 2 minutes.
Yeah,
so we
ahead.
also had our virtual gaming with a cop this year, which was strictly all. We let the year before we had virtual. This time we had smaller turnout because we wanted to keep people safe, but we felt like virtual people kind of didn't feel the same vibe. Every year, very successful. This was our third gaming with a cop. Next. And I think we're almost done. Movie with a cop. This is something we started. It's very exciting. I love the kids.
Yeah,
So it could be. I love the kids. So whether it's the recreation center, which are the kids this year, the kids from last week were from the recreation center. Some of them are from a school that we're working with. We pick the kids from random locations and we have a sponsor that comes out and we go to a movie that's obviously PG rated and they have popcorn and pizza, but more importantly, they have positive interaction with us, which we love. Awesome. Easter basket giveaways, something that you don't typically think that police do. And we can just cycle through. We had the summer kickoff, the safety fair event, those two, and it's only July, and we've already had 2 events. So we try to do what we can, sir. Very engaged, like I said, and I think that our units really love doing it. And we don't have to make them do it. They volunteer for this stuff, and they love it just as well.
That's so great. Thank you so much, Chief Ramos. That's a really comprehensive report. And, you had so many great initiatives to highlight. So thank you so much for that. Commissioner Bradshaw, go ahead.
Yes, Commissioner Terry, in the light of time, would you prefer just me to address my questions in another venue, or can I go ahead and ask them now?
No, go ahead and take a stab.
I'm sorry.
Yeah, go ahead.
Okay. First thing, Chief, thank you. My first request is for a copy of the presentation that you just did. So can you make that available to all the committee members?
Yes, sir.
Okay. Second question is, how are we doing on our head count? Sworn officers right now.
At last count, we were at about 625, sir, which is a little bit lower than we were last year and definitely a lot lower than we would like to be. However, I feel that I can confidently say that the officers are still chin up and still getting the job done. But yes, we are definitely a little less than we were last year, sir.
Okay, so our recruitment efforts, all the efforts that's gone into recruitment hasn't stemmed the tide of net losses. Is that a fair statement?
I would say that it isn't, just because the attrition is a little bit higher than we can fill. HR is working on a recruitment plan, and hopefully that will help us with some of our recruitment.
Okay, thank you. And then my last question is probably directed more toward Mr. Williams.
Mm-hmm.
If I'm not mistaken, in the last few weeks, I think the CEO intimated that this new tranche of ARP funds was going to induce some dramatic proposal with regard to public safety. Is that still in the offing? When might we see that?
Yeah, so I would just make a definitive statement that DeKalb County Police Department will be the highest paid large department in the state of Georgia. That is the CEO's commitment. That is our commitment. And you will see that in the mid-year budget. Whether it's through ARP, use of those funds or other funds, that's what we're going to make happen. To your first question, I just wanted to add, and thanks to the board for approving our recruitment efforts that are not only the traditional recruitment methods, but as you'll recall, we're hiring an executive recruiting firm. We're in the process of doing that, to assist in our overall a recruiting firm to assist in our overall recruitment of police officers.
Any time frame on when we're going to see this proposal?
In the next couple of weeks. Yeah.
Thank you, Mr. Williams. Thank you, Mr. Chair.
Thank you.
Great, thank you. And we're going to continue this conversation because I think whether it's the mid-year budget or talking about the Community Service Board Mental Health Partnership, I also did want to talk more about the PAL program. So, Mr. Williams, let's Mr. COO, let's put that kind of also back on
Absolutely.
the discussion, just to kind of dive a little deeper, because I think those are really impactful programs.
Thank you.
And talk about that holistic approach.
Mhm.
Let's, if it's okay, let's go ahead and tackle some of these agenda items real quickly. I think they're pretty self-explanatory, but let's just actually jump down to 1877, which is the UASI MOU, and maybe we can have Chief Ramos come back on and just tell us about that one real quick.
I don't believe that is police.
Oh, it's not police? Oh, okay. Oh, I don't have the link. What department is it? Anyone know?
Are we on the first item, the first change order?
1877, the UASI MOU, 420,000.
Yes, I believe that, Chief Ramos, I think that is radio compatibility.
It's a DEMA.
Go on, Chief. Lieutenant Ward, or
That's correct. It's under DEMA receiving the UIC funding, and it's in reference to the interoperability program. And Daryl Scott is on, and he will give you a breakdown of what the funds will be used for. If you can allow him to go ahead and speak, he can give you a little bit more detail exactly.
Yeah, if you don't mind, real quick, please.
Mr. Scott has the ability.
Thank you.
Hello, this is Daryl Scott from E911 Communications. Recently, well, as you guys know, the UIC program works to be able to interoperate with each other communication-wise. There's been a system in place called ISSI. It is where we can go to our channels on our radio station and talk across our current systems so that we can interoperate together. Well, the backhaul of that system resides on a aged microwave system. And it was time to replace it because it's beginning to fail, kind of like the DeKalb County microwave system needed to be upgraded. The UIC portion of the microwaves needed to be upgraded. But instead of upgrading the actual microwave, the committee that reviews that decided to go towards a hosted platform. And UIC agreed to use grant funding to proceed with building that out. It requires it's mostly fiber driven and internet hosted through, not internet, but hosted remotely from Motorola to get that traffic through. So which means we'll never have to update the microwave system again. We will never have to update it, but there are yearly reoccurring costs for the hosting, of course, which UIC.
Okay, I think I lost them. All right, and then I see $420,638.20. Is that what we're paying?
Yes, sir. Yes, sir. Commission is $420,638, and the feds are pulling it from different budgets over the years. What interoperability is, it gives the ability of field units, police, fire, sheriff, etc., and agencies to talk and share data in real time when needed and as authorized. So a DeKalb vehicle that is searching for someone down in Henry County still has the same capacity to operate. And it's really critical to public safety.
Okay, all right, very good. Any questions from the commissioners? Commissioner Rader.
Is there a match?
No, sir, there's no match.
Okay.
It's all being done with the Urban Area Security Initiative.
Great. Good. And then is this also with other agencies, not just DeKalb agencies across the board?
They're supporting the big five essentially, but the interoperability is being built throughout the state.
Okay, so this particular effort is the big five jurisdictions?
Yes, that's my understanding, is the big.
And is that at a county level so that we also get their municipal police forces in those counties? or is it just the agencies themselves?
The interoperability is built for all the agencies within the county.
So this will cover all of our municipals and then the municipals in other county jurisdictions. Is that right?
Now, their radio capacity, they'll have to have, and correct me if I'm speaking incorrect, Darryl, but they will have to have a radio that supports it, but
Right.
they will be able to use the platform.
Good. All right. Thank you.
That is correct, sir.
Okay. All right. Great questions. All right. Seeing no other questions, I'll open the floor for a motion.
Move that we recommend approval.
Second.
Okay. Motion and second. Seeing no discussion. All in favor, raise your hand, say aye.
Aye.
All right. Chair votes aye. Motion carries. Thank you. All right. Let's go back to 1602, which is our change order for our payroll tax wage deduction, employment verification, compliance services with ADP. Is that Director Ransom or Jacobs? Who can speak on that? Oh, Lorraine has her. Yes, Lorraine. Commissioner Cochran-Johnson, can you speak on that? Yeah, Zach.
No, but
So, I'm sorry, item 1602?
Yeah, 1602.
Okay, and that's going to be, I think, Larry. You can start
Larry.
after that.
if you don't mind, until Larry is able to get back on, I can certainly tell you some of the background information on this.
Okay, please do.
Okay. On this, the services actually were underestimated for this particular contract, and we found that we're going to need additional money to complete the services for the next year. And this covers just the basic ADP processing that they do for us, which is all of our tax and payroll and unemployment.
Okay. Any questions from the committee members?
Move we recommend approval.
Okay. Motion. Got a second?
I'll second it. Did you want to address Commissioner Cochran-Johnson's question?
Oh, yes, Commissioner
before we
Cochran.
take action.
Yeah, Commissioner Cochran-Johnson, did you have a question on this item?
No, not on the item, but on the timing of the committee. I would respectfully ask that we move into PWI, as it has become a running standard that unfortunately we do not have the ability to begin on time, and it affects my ability to adjudicate my
No, we got the ERPS sandwich here. This is the ERPS sandwich, is that what we're calling it now? It's the only one that's
understood,
in the middle.
but this is never
The only
been
one's in the
history.
middle.
It has unfortunately not been the history of the commissioners and the chairs to run over, or if so, to respectfully ask the next committee chair whether or not it's permissible. Sometimes it is, but we're not in that position.
No, yeah, trust me.
Thank you
I'll be the
for
first
the-
to say that we don't have enough time to do our business in these time slots. So that's why we got a whole suite of special call meetings, planned. And so I hear you. So we'll go ahead and take care of these last items, and we'll do some deferrals before we start PWI, which I think will help us a little bit. So we got a motion and a second on the table for item 1602. Seeing no discussion, all in favor, raise your hand, say aye.
Aye.
Chair votes aye, motion carries. All right, last two here to take action on. Item 1878, and this is the FY 2021 Emergency Management Performance Grant, EMPG. Who can speak on this one?
Lieutenant Ward, is that you?
I've read that. It's just 50,000 for personal protective equipment.
That's correct.
Okay, all right. Well, if we
So I
don't,
would move we recommend approval.
okay.
Yes, that's correct.
All right, motion on table.
Second.
Second. All right, seeing no further discussion, all in favor, raise your hand, say aye.
Aye.
Chair votes aye, motion carries. Next is item 1879, amendment to the DCFR Medical Director contact.
Chief Fulham?
DeKalb County Fire Rescue. Yeah, there you go. Chief Fulham.
Yes, good afternoon, Chair and Commissioners. This is an amendment to the contract, the medical director's contract, to allow him to provide services to the police department. As you may recall, you all approved a grant that the police department received for Narcan. As part of that grant, they need to have consultation and oversight from a medical director. There's no cost to the county.
Okay. Committee members, any questions?
Move we recommend approval.
Second.
All right, motion is second. Seeing no further discussion, all in favor, raise your hand, say aye.
Aye.
All right, chair votes aye, motion carries. All right, so we've checked everyone's schedule. And so these last items that were previously heard, we're gonna do a little deferral rodeo here so we can go and clear the logjam. So I believe for item 1299, we are looking at a special call meeting for August 11th at 1 p.m. So if that indeed works for the committee members, I would love to hear a motion to defer to August 11th, 1 p.m. special call.
So moved.
I will second that. Does that mean that, you're recommending a deferral of the date we take action on commission, right? So you want to defer this until the 23rd, right, for action? That's
a great question. Central staff, do we need to do two deferrals at this? In one motion? I'm trying to, because I feel like we still have to defer it at the main board of.
You're not going to take it back up in the committee until the 11th, and it needs to be deferred till the 22nd, and that's my motion.
Okay, but I thought that we could only defer items at the actual Board of Commission meeting.
Right, but the recommendation is to defer until the 23rd. So when we go to the Board of Commissioners meeting, the committee will recommend that this item be deferred to the 23rd, and you'll take it up in committee on the 11th.
Gotcha. Okay, actually, I'm gonna tell you what, we're gonna hold on this one because I think we actually don't need to defer this long. So let's just pause on 1299. We'll just get it, we'll just bring it back up next committee meeting. So in that vein though, Commissioner Rader, we had the election day as a holiday one, also looking at August 11th at 1 p.m. So if you could make that motion for the item.
We recommend the item be deferred to the Board of Commissioners meeting on the 23rd.
Okay.
Which one are you talking about?
1656.
Okay. Second.
Okay. All right. And then we'll have a special call meeting on August 11th at 1 p.m. on that item. And motion on the table, second. All in favor, raise your hand, say aye.
Aye.
All right. Chair votes aye. All right. And then the last two related to gun safety and gun violence and legislation. Item 1764 and 3499, we are looking at an August 25th at 1 p.m. special call meeting. So
move to recommend that this item then, these items be deferred until September 13th.
Okay.
Second.
All right, we've got a motion and a second. Seeing no discussion, all in favor, raise your hand, say aye.
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 All right, chair votes aye, motion carries. All right, that is the end of our agenda. Take a motion for adjournment.
Move to adjourn.
Second.
All in favor?
Aye.
Aye. Thank you all.